I'm an open book, so just ask any questions that you have. But my name is Courtney Mayer. I'm an account manager on the Wellabe sales team here. I've been with the company for 13 years now. I've done different departments along my way here, but I've been on the sales team for the last 4 years now. So as many of you may know, last June, we actually rebranded to Wellabe. Most of you may know us as Medico, but we're Medico, a Wellabe company. The reason behind that change is that we had multiple companies that rolled up to one. So we wanted to have one brand. So they came up with Wellabe. And as you see throughout the presentation, there'll be interlocking L's in the Wellabe. That represents that we will always be here for you as the agents and for your policyholders. If they ever have to call in, we will always be here to help in any way that we can. But we've been in business since 1929. We are an A-rated company with AM Best, and just know that you always have access to our underwriters as well. If you have a question, maybe you're doing a med sup or on a hospital indemnity, maybe you just want to run something by somebody, you can always reach out to me, but you always have access to our underwriters as well here at Wellabe. So as Amanda said before, we're going to talk about hospital indemnity first here. We'll get into the other products here in a little bit, but we're going to start with our hospital indemnity. So a few things before we really get down into it here is our issue ages are 18 to 85. Last November 1st, we opened up our guarantee issue. So we have a guarantee issue from 60 to 79. Yes, 60 to 79, there is that guarantee issue. So no health questions are even going to come up when you're completing that application. Now, if you have somebody that's applying and they live with somebody that is over the age of 18, they are going to get a 7% discount for that. So it can be a grandchild, a child, a roommate, or if they're married, doesn't matter as long as they just live with somebody that is over the age of 18. Unfortunately, it cannot be Fido the dog. I wish it could, but unfortunately it can't be. It has to be a person in order to get that discount. And on average, we are about 10% cheaper than our competitors. We've had this in place since 2018, and we actually a few years ago went in and took a 10% decrease to make us more competitive. So we've never had a rate increase on this book of business, which I'm happy to say that we've had it in for that long, and we've not had to have an increase on this product. So one of the questions before was, do you have this product available in Minnesota? And yes, we do. So here is that product availability chart. Anywhere that you see in that pinkish color is where we have the product that we're going to be talking about today. Now, if you're maybe in one of those states where it's not at, we are always looking to add more product in each state. So just kind of stay tuned. Whenever we do have new states available, we will definitely let Amanda know and everybody else know when that is available. But we're going to start off with the product overview here. So all of this is going to be included when you have somebody that selects, say, 6 days at $300 a day. They are going to get all of this in their plan. These plans were designed to go hand in hand with your Advantage policies to help offset their out-of-pockets and deductibles that they have with those plans. And it goes down to age 18. So it's really for anybody that has maybe a high deductible policy as well. I have a plan on myself, and I'll talk about that and which riders I wanted when I was thinking about taking this policy out. So when your clients can select from $100 to $600 a day, and it goes up in $25 increments to really help tailor to each of your clients' needs, wants, and also their budget. Then they're able to select the number of days. So they can select from days 3, 6, 7, 8, 9, 10, 21, or a 31-day benefit period. What is nice with this is there is a lifetime restoration of benefits. So say they've selected 6 days, $300 a day. They go in and they're in for 6 days. Once they are carefree for 60 continuous days, we are going to reset that back to those 6 days for them. And then that can happen as many times throughout the year. If anybody's ever heard me talk before, math is not my strong suit, so I don't know exactly how many times, but that can happen as long as they're carefree for 60 continuous days. We will reset them back to their number of days that they selected. Then we have the observation unit benefit, because most of the time when people go into observation, they don't realize that they're in observation, because to them, they're in the hospital. They're in a hospital room. So they think that they are inpatient. But if it's coded over as observation, we would pay 100% of the inpatient benefit for 6 days in a calendar year. What is nice is there's no minimum or maximum hours required per stay in order for that to work. Then we have the emergency room benefit. This is going to cover 150 for 4 days in a calendar year. They do have to go to the emergency room either due to an accident or injury in order for that to cover. Then the inpatient mental health benefit. That is going to cover $175 for 7 days in a calendar year. Now the last one down there. This is kind of unique here to Wellabe. It's the transportation and lodging benefit. It's going to cover $100 for up to 10 days in a calendar year if they're having to travel more than 50 miles from their residence to receive treatment in a hospital setting. So think about your rural clients, where they are having to travel to get care. This is a great product because they are going to get everything we just talked about when they select, say, 6 days, $300 a day. Now we're going to get into the riders because the riders can really tailor to all of your individual clients their needs. We're going to start with the ambulance benefit rider. This is actually our most popular rider that we see come through with applications. It's going to cover $250 for up to 4 times in a calendar year. And I said 4 times because say you have somebody that lives in that rural area. They're going to call, their ambulance is going to come get them. What's the ambulance going to do? It is going to take them to the closest hospital. Well, say they get to that hospital and, it's a smaller, they're not equipped to provide the services that that person may need. What are they going to do? They're going to put them in another ambulance and they're going to send them to the next hospital that will be able to provide those services for them. So 4 times in a calendar year, and there is a lifetime maximum of $2,500. Now, the outpatient therapy and chiropractic service benefit. We like to call this the buy one, get one. How this works is you're going to get $50 for either 15 or 30 days per calendar year for outpatient therapy. I don't know if anybody out there has ever quoted this rider before, and I just want to bring it up because if you never have, it's not much premium difference to get the 30 days as opposed to the 15. Some people may think, well, I'm getting 30 days. It's going to cost me a lot more. It's not. On average, it's about 80 cents difference to get those 30 days as opposed to the 15 days. Then there's up to 5 days per calendar year for chiropractic services as well. Now, our number 2 most popular rider that we see come through, that is our outpatient surgery benefit rider. This is going to cover either $250, $500, $750, or $1,000 per day for up to 2 days per calendar year. Think about cataract surgery. If someone has one eye done, they're going to want to go back and they're going to get the other eye done as well. So again, when we're going through these, you're going to see that we have options for everybody within different price range, different advantage plans that they may have. There's something out there for everybody. Sorry, I didn't want to cough in your ear there. Now, our skilled nursing facility care rider. This is going to cover either $100, $150, or $200 up to 50 days in a calendar year. Now, there is a one-time restoration of benefits. So if they are carefree out of the skilled nursing for 180 days, it will reset one time during the life of the policy. This is nice because we're going to cover up to 50 days. So we can have it that your clients can select, they can have it start paying day 1 and we would pay in addition, or if they wanted it to start paying on day 21, completely up to your clients how they want us to pay on that. And that's what's nice about these policies. It really gives your clients the control for their policy that they have with us. Now, I'm going to talk about that dreaded C word, the lump sum cancer. We have it as a rider. We also have a standalone cancer policy. But I think cancer insurance is one of those things that people have the mindset, I'm not going to talk about it. So if I don't talk about it, it's not going to happen to me. Unfortunately, we know that that is not true. Cancer does not care who you are. It does not care what you do. It doesn't care. And if we were in a room right now, I would say, raise your hand if anybody knows anybody that's been diagnosed with cancer. Unfortunately, we all would probably be raising our hand right now because we've all have known someone that cancer has affected. So the lump sum cancer benefit rider is a great rider because your clients can select either $1,000, $2,500, $5,000, $7,500, or $10,000, this rider is available up to age 80, and it is going to cover for internal cancer or malignant melanoma is how that rider is going to work. Now, I told you a little bit earlier that I have a policy on myself. So I took a policy out for the cancer rider because my grandma was a 2-time breast cancer survivor. And you know, when you look around, there's a lot of people that you know that in some way cancer has affected them. I talk about this product every day. I truly believe in it. So I took out the base plan at $100 a day for 3 days because I wanted the lump sum cancer rider. My monthly premium is $7.28 a month. Think of all of the things that like I would buy in a month that end up in the trash can, that end up broken. At least with my policy, it is bringing me value. So I also have one on my husband as well. So for both of us combined with the same benefits, 3 days, $100 a day, $10,000 lump sum cancer, our monthly premium combined, $16. That's one appetizer when we go out to dinner, or maybe 2 drinks if we go out to dinner. So with these policies, I can't stress enough the value that you'd be getting and how affordable these are. Now, I do have a slide in here that shows you, your clients when they're 65, 70, what those would cover as well. But I like to bring that up because, again, these plans go down to 18. So they're, designed to go with your Advantage plans. But if you have somebody that has a high deductible policy in general, or somebody that's just looking for a cancer policy, these are great policies to have. Now we're going to go on to the urgent care center benefit rider. This is going to cover $50 for up to 4 days in a calendar year. Say someone cuts their finger. They know that they need stitches, they need care, but I don't know about you guys, but whenever we have to go to the emergency room for anything, it seems like we're there for absolutely ever, no matter if it's for a cut or if it's for a broken arm. I have 2 boys, so we've been there for a few different things before, but it seems like we are there forever. So I've had people say, I had a policyholder, they cut their finger, they needed care, they went to urgent care, they were in and out in a fraction of the time. Now, the last one, the lump sum hospital confinement. How I describe this rider is, say you have somebody that is needing more than $600 a day, because that is what our base policy goes to, is $600. They can add the lump sum hospital confinement benefit rider for either $250, $500, or $750, and it would pay in addition to their base plan for up to 3 benefit periods in a calendar year. So there really is something out there for each individual's, their wants, their needs, and then also their budget as well. Now, with our plans, it's like I said before, I'm trying to move my screen there. There we go. We have guarantee issue from the ages of 60 to 79. So if they're within that age bracket, no health questions are even going to pop up when you're completing these applications. Now, if you have anybody that's outside of that guarantee issue window, we are going to be asking 9 health questions, but they're within the past 12 months is what those questions are. And here's just an example of some of those questions that you would actually be seeing when you're completing those applications if they're outside of that guarantee issue window. Now, a big thing is there is a 6-month pre-existing. So I'm going to use asthma. If anybody has asthma, they can still take out the policy. But if they go into the hospital and they're hospitalized within the first 6 months because of asthma, it's not going to be covered because that is a pre-existing. But month 7, it's going to be covered for them. But now they get diagnosed with a brand new condition, that's going to be covered right away for them. And I'm going to bring up cancer because that's always a hot topic. That question always comes up. Say I have somebody that has cancer right now, they're 65. Can they take out a policy with you? The answer is yes, and they can get the cancer rider. However, we are only going to cover a cancer diagnosis that was diagnosed while the policy was in force with us. So say somebody takes it out, they have breast cancer. That breast cancer is not going to be covered, but say in a year or 2, they get diagnosed with a new diagnosis, maybe kidney cancer or anything like that, that would be covered. And so if there's questions on that, please let me know, but I always like to bring that up because that is a question that we always get because that's a hot topic and we know that. So if there's want more clarification, please just let me know. But let's look at this here. This is a policy based upon a 70-year-old female in the state of Iowa with the household discount of 7%. So for the base plan, 6 days at $350 a day, the monthly premium is $21.63. The ambulance rider, $3.41. Now we're going to jump down to the lump sum cancer rider. For $5,000, it's $9.16. I always joke about this, but it's kind of true. My Starbucks coffee that I had this morning, it was great, but it almost cost me as much as a cancer rider. So when people, a lot of times people may think, I don't need that, it's not going to happen to me. We all know that's not true. So I just like to put that into perspective, how affordable these are, because, when I was first starting to do this, I'm like, but I've had a plan on myself for as long as I could from when they adjusted the ages here on that. And now I like to share this screen here because it really puts in how a financial situation can affect somebody that's not prepared for it. We don't have that crystal ball. We don't know on, this day at this time, I'm going to be walking to my mailbox, I'm going to fall, I'm going to break my leg, and I'm going to have to be in the hospital. We don't know that. So we all know that unexpected healthcare costs can damage financial situation. So this was a poll that was National Public Radio, the Robert Wood Johnson Foundation, and the Harvard T.H. Chan School of Public Health. They surveyed 2,000 adults nationwide. The research found healthcare costs cause serious financial problems for patients over the past 2 years. So 44 had to set up a payment plan with their hospital or healthcare professional. 42% spent all or majority of their personal savings on medical expenses. 27% were unable to pay for basic necessities such as food, heat, and housing. 23% took on credit card debt, and 7% declared bankruptcy, all because they were not prepared for a situation, because some people have that mindset, it's not going to happen to me. So that is our hospital indemnity. I'm sorry, I did not have my chat open here when we were going through this, so I apologize for that, but I opened it now here. But now we're going to move on to our dental insurance. So we have 2 plans. We have the gold and we have the platinum plans available. So again, here's that product availability chart. Anywhere that you see in green is where we have our dental plans available at. And so we have the gold and platinum. We have the option to add a spouse. So at time of application, if somebody is applying and they want to add their spouse, they're going to get a 12% household discount for that. It's going to be one application that you would complete, but spouse A is going to get their benefits and spouse B will get their benefits. We have first aid coverage even on major services. And again, we're going to talk about that on the next slide. But we have 2 great riders that can be purchased at time of application. So we have the buy-up benefit rider. That is going to add $1,000 worth of coverage. So if they selected the Platinum 1500, they purchased the buy-up for $11.95. That is going to give them $2,500 worth of coverage. We also have the carryover benefit rider. This has been an extremely popular rider that we have seen come through on applications. How it works is it's going to allow your client to carry over any unused benefit until the next calendar year. Now, think about as we get into the later months here. Say they've already had their cleanings and maybe they just need to have a cleaning. This is a great rider to add if they know that maybe they're going to need something in the future, because then they can carry over that into the next calendar year. Just to give you an insight, the number 1 day that we've seen come through with dental applications with this rider last year was December 27th. And that was our most popular day that we've seen these policies come through, because they were able to carry over that benefit until the next calendar year. And they can do that until it reaches a maximum of $3,000. We have the multi-policy discount also. If they have a Medicare supplement policy with us, they're going to get a 5% discount for their dental. So if they're adding a spouse and they have a med sup, they could potentially get a 17% discount on their dental plans for that. They're all individual plans except that they're adding the spouse. The issue ages are 18 to 89. Now here is our product chart. So when you're looking at this side by side, they look very similar. So for both plans, the gold and the platinums, there is for calendar year deductible, there is $0 for preventative services. There is a $50 for basic or major services. Preventative services on both plans are covered at 100% with no waiting periods. The difference between the two plans is going to be on your basic services here. So for the gold plans, we're going to cover 50%. And on the platinum, we are going to cover 80%. There's no waiting periods. It's just going to depend upon what percentage they would want to be covered. And then the platinum plans, they will be a little bit more than the gold plans. Now, major services for both are going to be covered at 20% within the first 12 months. After they've had the plan for 12 months, then we're going to bump it up to 50% of coverage. With our dental policies, there's no coordination of benefits. So we will pay in addition to, maybe they have an advantage policy and it's covering a little bit of benefits, but it's not covering everything maybe they need. They can have our plan and we would cover that in addition to. And there is a passive network. So if they used an in-network doctor through the Zealous network, they're going to get that negotiated rate. But they don't have to use that in-network doctor. Say they've been going to the same dentist for 20 years. They don't want to change and that doctor's not in network. That is fine. They can still go there. We'll still cover the same percentages that you see here. It's just they won't get that negotiated rate that an in-network doctor may have. All right, now we're going to move on to our Medicare supplements. So our Medicare supplements are available in all of the states here. Now I will say, this isn't as colorful as some of those other maps that we have for some of our other products, but we are, and I know I can't say the state yet because I don't have definite in writing yet, but we are looking to expand into more states for our Medicare supplement products here. So again, stay tuned. We will definitely let you know when that is available and what states they're going to be. But with our Medicare supplements, if you have somebody that's applying, and they live with anybody that is over the age of 50, they're going to get a 10% household discount for that. And when you're quoting our med subs, you're going to know that we are more competitive in your bigger cities as opposed to your more rural areas. So just keep that in mind. If you are maybe in some more rural areas, I'll be honest, we're not going to be as competitive as what we're going to be in those bigger cities. But when you're when you're enrolling in our Medicare supplement policies, on our My Enroller, you'll notice that you don't have to input prescription drug medication because we will check that on Milliman on the back end. So that's going to help save you time. You know, all the prescriptions, they always seem like they're this long, they have every letter of the alphabet in it. So with that, you'll still have to answer yes, they've taken a prescription medication, but you don't have to input that information in. And when you're completing the applications, we have an instant decision. So we're going to check the prescription on the back end. If everything looks good, you're going to get a decision of either it's been issued, it's been declined, or in some cases, if it does have to go to an underwriter for further review, it is going to tell you that in about a minute after you complete the application on My Enroller. We are doing that to help save time. That way, you have that answer for your client right after you've completed that. And like I said, in some cases, it does have to go to underwriting for further review. If that ever was the case, it's on average, it's about a 24-hour turnaround time for a fully underwritten app if underwriting has to do a telephone interview and things like that on it. All right, we talked about cancer as a writer. Now I'm going to talk about the standalone cancer policy that we've had. We've had this product around since the 1980s. It is available in 30 states. So anywhere that you see in blue is where we have this product available at. This product covers either 10,000, 15, 20, or 25,000. Now, I will tell you, if you're in Virginia, I'm sorry, we don't have this available. If you are in South Carolina, we only have the $25,000 plan available for this. But it's 18 to 79 are the issue ages on this. We actually have a 99% issue rate on this policy as well. And it's going to cover for first diagnosis of internal cancer or malignant melanoma. Again, I like to show how affordable these cancer plans are, just because I think it's one of those things that, people know that they need auto insurance. They know that they need homeowners insurance, but they don't think about cancer insurance until it's too late, until they're not going to be able to qualify for a policy. So this is based upon a $15,000 lump sum for a female in the state of Iowa, with the household discount, because if two people that are living in the same household apply and they both have to be issued, they are going to get a 10% discount for that. So someone that's age 20, $12.15. If we jump up to age 50, $21.60 for this. And if we even go to the max age, because it goes from 18 to 79, $47.25 for one of these policies. All these products that we're talking about here, you'll have access to our My Enroller if you're already contracted. If you're not, when we get closer to the end, I'll give you the link where you can go to our quick quotes. So that way you can quote the product if you're interested in getting contracted. I'll make sure you have that so you're at least able to see what our rates look like for the state that you are in. Now, the last product that I'm going to talk about here today. This is our newest product that we just brought to market the end of last year. We actually just went in March 1st and added 14 more states. So right now we have it available in 24 states, but it is our short-term care insurance. So short-term care insurance not only helps your clients maintain an active lifestyle while aging in place, but also make sure their retirement savings are well protected. They can do more, worry less, and make every day better. Because this product is a short-term care policy, so they can select up to 360 days, up to $300 a day. And I'll get into the benefits here in a few more slides, but this was clients age in place at home. There's a facility rider that can be added if they wanted to, but when we were designing this product, that was the biggest feedback that we got. People want to age in place. So this is where we have this at now. Again, stay tuned because we are looking more to add more states on this as well. But let's just kind of go over some numbers here. So according to the Administration for Community Living, someone turning age 65 today has almost a 70% chance of needing some type of long-term care services and supports in their remaining years. On average, 42% of people need less than 1 year of at-home paid care, and 37% of people need less than 1 year of any skilled care in a facility. When one healthcare situation leads to in-home or skilled nursing assistant, it can quickly deplete funds. Extended care is expensive and costs can add up quickly. Here's a look at the estimated national average cost in 2023, according to the U.S. Department of Health and Human Services. On average, an American turning 65 years old today will incur about $121,000 in future extended care costs, measured in today's dollars. Families will pay more than 1/3, about 37% of the cost themselves out of pocket, with the rest covered by public programs and private insurance. So this product, it's going to be easier to qualify for than your traditional long-term care, and it is going to be available. Excuse me, I was reading a question there. I can't do two things at once. So it's going to be easier to qualify for, and it's much more affordable. So this was a great question. Are these policies portable? Buy in one state and then they move to another? That is a great question. So yes, all the products we've talked about, if they purchase it in a state that we have it available in and they move to a state where maybe we don't have it, it will travel with them and they will still be able to keep that policy. Or if they're on vacation and they're visiting another state, that policy, yes, it will travel with them. That is a great question. Thank you for bringing that up. Now let's go over the product overview here. So we have the Essential Care Plus, Essential Care, and the Limited Benefit Rider. So the Essential Care Plus, that first one there, this is that they answer no to all the health questions. It's fully underwritten policy. They're going to get up to a daily benefit up to $300 a day for up to 360 days of in-home health care. On this one, there is a 0 or a 20-day elimination period. Also, benefits can be restored one time. If they are carefree for 180 days, it will restore one time during the policy. So the Essential Care Plus, that's going to be for your healthy clients. That's going to be that they can answer no to all those health questions on the application. Now, say you have somebody that is going to answer maybe a few questions yes on the application. Then we have the Essential Care. So this is if they answer no to the first 6 questions and they answer yes to any of the remaining questions. So some of the questions that are going to be asked, are you currently receiving home health care? Have you been advised that you need to receive home health care or assisted living? Do you have cancer? Things like that. Those are going to be the questions that are going to be asked on the application. So it's less restrictive underwriting. They can get up to a daily benefit up to $150 a day for up to 360 days of in-home health care. And on this one, there is a 20-day elimination period. Now, our last one, the limited benefit rider. This is going to be for your clients that's going to be answering more yes questions. How it works is they answer no to the first question, but they answer yes to questions 2 through 6. And they are applying with somebody that has qualified for one of the first 2 plans we talked about. They could get the limited benefit rider. This is going to give them a daily benefit up to $100 a day for up to 180 days of in-home health care with a 90-day elimination period. And I will email over Amanda the questions, so that way if you guys want to see what these questions look like, you have them. If you're contracted, you can go on My Enroller and you can see those, but I'll make sure that you guys have what those questions are that are being asked on the application. But these are great plans, especially, depending upon how somebody may answer. Somebody may not get qualified for another plan, but ours is a little bit less restrictive. They may be able to qualify for one of our policies, especially with that limited benefit rider, if they are applying with somebody else that is applying. Because we've also learned that people, couples, when they are applying, they want to stay with the same company. They don't want someone to have a policy over here and another one over here. If they can, they want to stay with the same company. That is why we've opened it up to offer that limited benefit rider. So again, this is focused for in-home healthcare, but we also have a lot of great riders as well. So we have the nursing facility care rider. This allows clients to elect a daily benefit up to $500 a day for up to 360 additional days of care in a facility with either a 0 or a 20-day elimination period. This rider includes a 21-day bed reservation benefit that pays the daily amount to hold a care facility room during a hospital stay. Then we have the nursing care rider with inflation protection. It's going to cover the same we just talked about, but it also increases the daily benefit amount by 5% of the original daily benefit on each policy anniversary. I'm sorry, I don't want to keep coughing in your guys' ear here. Now, the inflation protection rider. This can be added to the home health care benefit as well, but it's going to increase the daily benefit amount by 5% of the original daily benefit on each policy anniversary. Then the adult daycare rider, that second to last one down there, that is going to pay $50 for up to 20 visits in an adult daycare setting. This is also eligible for a one-time restoration of benefits if they are carefree for 180 days. Now, the last one down there is our return of premium. This is going to allow a portion of the premium to be returned if the policy is terminated. This is a graded benefit based on the duration of the policy. So how it works, after 10 years, 25% of the premium is returned. 15 years, 35% of premium is returned. And after 20 years, 50% of the premium is returned. Of course, the payout is minus any claims paid at time of termination. Now, the same with our other products. We have a lot of different discounts because we try to offer discounts when and where we can with any of the policies that we have. So let me get my next screen here. How it works is 7% for one applicant who just lives with someone over the age of 40. They're going to get 14% if 2 people over the age of 40 are, because its issue ages are 40 to 89. If they're both applying and they're issued either the Essential Care Plus or the Essential Care, they're going to get a 14% discount. Now, if you have a couple that's applying and either one of them is issued the limited benefit rider, they're going to get a 5% discount for that. And if they have a Medicare supplement policy with us already, they will get a 5% discount. So it can be a Medicare supplement. Maybe it was written 5 years ago, or maybe it was just written 5 months ago. It doesn't matter. If they have a Medicare supplement plan, they will get a 5% discount for their short-term care plan for that as well. Now, I know I've gone over a lot of information here, but we try to make it as easy as possible at Wellabe to do business. So the main thing is our agent website. If you're contracted, you will have access to this. If you're not contracted, Amanda will be able to help get that going for you. But if you go to wellabe.com/sign in, this is going to give you access to all of our material. So we have brochures that you can go order. We actually have PowerPoint presentations as well that have already been approved by our marketing and compliance department. You can use those with your policyholders when you're presenting any of our products. We have them to where you can see them with the notes, or if you want to just see them without the notes, those are out there available as well. That'll be under the product info tab when you are on the Wellabe website. Now, our My Enroller. This is where you're going to be able to submit applications. We do not accept any paper applications here at Wellabe, so everything does have to come through to us using our My Enroller, but you can put it on your desktop, your laptop, tablets. I've even had some people say they put it on their phones before. Then some say they don't like it on their phones because it's too small. So it's really a personal preference on how you would prefer that. But you're able to quote, and you can send a quote. So say you're talking to somebody and they want you to email them that quote over. You can email the quote. It's going to send a copy of the quote, the brochure, and then your information and your phone number as their agent will all be sent over to your applicant. And it bypasses data entry, so it automatically loads into our system. So as I said before, depending on the policies you're doing, especially if you're doing a demo policy, there's no underwriting on those. Those are going to go straight through and you're going to be issued a policy number. But we also have a lot of great signature options. And our newest one we just brought was you can either text or email a code while you're on the phone with your applicant. So if they're present, of course, you'll just do applicant as present. But if you're doing it over the phone, you can do a text. It's going to text or email, and it's going to email them a code. And then you're able to capture that signature right then and there while you are on the phone with them. You don't have to, hang up and just, say, hey, have you signed that application yet? You're able to capture that all right then and there. So I'm going to end it with our incentives that we have going on, because we have incentives for most of the products that we have available. So our first one is our Medicare supplement incentive. How this works is submit 3 qualifying med subs. You're going to get 150 for your underwritten, and you're going to get 15 for open enrollment or guarantee issue. What's nice is we retro back and we start paying on that first application. So once you submit your 3rd application, we're going to go back and start paying on that very first app. The middle one, this is for our hospital indemnity. How this works is you have to submit a minimum of 5 qualifying hospital indemnity applications, and you're going to get $100 per policy. How this works, though, is there has to be at least a minimum of $25 monthly premium or a $300 annual premium in order to qualify for that. But again, we go back and start paying on that very first application. Now, our last one is our short-term care incentive. So the first 2 are for quarter 2. The short-term care actually started back in January. So this is going from, it's quarter 1 and quarter 2 for the short-term care. How it works is if you submit 3 qualifying applications, you're going to get 150 for each qualifying. But then once you hit that 3rd application, you're going to get a kicker of $400. So there's a lot of great incentives for all of the products that we have here. And I know I've gone over a lot here, and I want to make sure that you have my information. So this is my email. This is my phone number. You can come directly here to me. If there's ever any questions or ever anything that I can help with, please let me know, because that's what we are here for, to make it as easy as possible for you guys when you're out in the field. So please let me know if there's ever anything that I can help with. Maybe if even a claims question. I may not be able to see that, but I know who I can get in contact with to make it easier for you guys when you're, out in the field doing things.
Is there a way to review health questions per application type?
There is, so if you're contracted already, you can get onto our agent website and then go to the product, and then the application will be there, and then you can see the health questions that will be asked for each of those. And I can send them, if it'd be easier, man, I can send them to you.
Okay. And then the other question was in regard to the hospital indemnity. If it's guaranteed issue, will there be a waiting period on pre-act?
No, so they still have to have the 6-month pre-existing, even if it's guarantee issue, there's still that 6-month pre-ex before things will be covered.
Okay. Any other questions that you guys have? You can come off mute, or you can put them in the chat or the Q&A.
And I always say, oh, I'm sorry.
I'm sorry. I have a question. It's Connie from Little Rock. You mentioned the discounts. Does it matter, the discounts? Is there a limit on the discounts? How they compound? If so, you write somebody 4 apps, do the discounts still on top of each other, or is there a limit?
No, there's not. So if somebody has a dental policy and they can get those discounts, if the spouse is applying, or if they have a med sup, they would get that discount. If you're writing them a short-term care, then they would be able to get those discounts as well for that. And that's a great question. I've never been asked that. That is a great question. So thank you for asking that, because I'm going to make sure that I incorporate that into everything now.
Thank you.
And then can you have more than one policy? Example, the cancer rider on the hospital indemnity plus a cancer policy that's standalone.
Yes, so you can have the hospital indemnity with the cancer rider and the standalone cancer, yes, because it's 2 separate policies, but you cannot have, say, 2 hospital indemnity policies with us. You could have one with us and one with someone else, but yes, they're considered 2 separate policies.
Awesome. Let's see, what else we got? I believe that's all the questions that we have. Can you do me a favor? Do you have the ability to go onto the Medico website real quick and show some of the marketing materials that you have?
Oh, absolutely. Let me get that pulled up here. Just gotta find where it's at, and then I can show where all of that is at. All right, let me get it dragged over here. So once you get logged into the website, you're going to have all the tabs up here. So the product info tab, it'll give you each landing page to each product that we have. So I'll just do hospital indemnity. If you click on hospital indemnity, it's going to give you the product chart. But if you scroll down, it is going to give you the consumer presentation. There's the one with the notes. We also have a comparison worksheet, so you can actually go in and put your client's current policy that they have, and it'll show their out-of-pockets that they have. And then at the bottom, you'd be able to go in and plug in if they had a Wellabe hospital indemnity, and it's going to show them what we would cover and then what they would receive, or what they would be responsible for. But it's going to be a lot lower of a cost than what it would be. Let me get it pulled up here. Here it is. It's but easier than me talking about it. So up at the top, you plug in their current policy. It's going to give them the total out of pocket. At the bottom, plug in if they had a Wellabe. Then it's going to show what we would pay for it. I know that I'm a very visual person, and I think a lot of people are. You can say, oh, you're gonna have this much out of pocket. It's like, okay, but once you're seeing it in writing compared to your current policy, it's kind of eye-opening. So it's a great worksheet that we have available out on the website as well. So you'll be able to get the product information for any of the products by going there. If you need to order brochures, you'll just go to the general forms and then order supplies, print forms. That will allow you to order brochures. We have postcards out there. We have flyers. There's a lot of great material out there. So if you haven't had a chance to take a look at it, I encourage you to go do so, because it is free of charge. There is a maximum of 100 that can be ordered at each time, but there's no charge to you if you want to go print those to mail them out to your clients.
So thank you. Next question. If I'm using a connector-based system like Smart Enroll or any of those, do we have the ability of quoting and enrolling through there for you, or do we have to only use your system?
So CSG, you can quote from there. And then you can enroll with our Hospital Indemnity and our med subs from the CSG website. But right now, that is where we are available to quote without going to our website. But I do want to tell you, I'm going to pull this up here too, because if you're not contracted with us, you can go to quickquotes.myenroller.com right there in my web browser. And you're able to quote from here. You don't have to have a login. You don't have to have anything like that. And you can actually put it on your
Can you do
phone.
a quick copy paste of that link so they can bookmark it, please?
Oh, yep. And in that way, there you go. You are able to have everything right there. Did I do it right? Did I just send it to you, Amanda?
Yep.
Okay. I always joke, like, technology, sometimes I'm good if I know, but I'm not too tech savvy all the time.
Do you also have social media ads available?
So we are working on getting that available. So we are, since with the name change and everything that happened last year, they're rebranding everything. So yes, stay tuned. Those will be coming soon, but we just don't have them quite yet.
And then where are the underwriting questions located?
So if you
The
want
link is
to,
in the chat box, Tamila. If you scroll up a little bit, you'll see it, honey. And then the underwriting questions, where are those?
so the underwriting questions, if you go, let me pull up the website again here. Oh, it kicked me out. But if you go to the order supplies print forms tab on the website, that is where you're going to be able to go, and you'll have to select your state and select the product that you're wanting, but then you're able to pull up those health questions. So here, let me pull that back over. So orders, general forms and supplies, order supplies, print forms, go there. You'll be able to pull all of, we do have a paper application out there. It does have sample written across it because we don't accept those, but we do have it. So you're able to see the health questions. If you ever want to look at the Medicare supplement underwriting guide, if you go to product info and go to Medicare supplements, we have our Medicare supplement guides down here at the bottom. So there's a lot of different great information out there. And like I said, if you ever have any questions on where to navigate, how to find anything, I'd be happy to help with any of that.
Okay, other questions that you guys have? I like that you guys have been interactive today. That's awesome.
Yes, that makes it, well, yes, thank you.
I will say that one of the other things, because if you're new and you may not know this, Hospital Indemnity, you can, and the cancer plans, you can sell them typically at the time that you are actually doing a MedSup or an Advantage plan. However, I highly recommend that you do it after the install. So if you have not taken my How to Have the Sales Conversation class, which I teach pretty regularly, I believe it's also out on YouTube. I teach what you do on a phone pre-screen, what you do actually at the appointment. And then after you do an application, that's when you do a 10, 15, 30-minute meeting with them. And you talk about how they utilize the benefits that they enrolled in their Advantage plan. But then you also have a time during that conversation to talk about Hospital Indemnity, cancer, if they mention that they're doing any foreign travel, so your international travel plan. But that's when you have that conversation so that they're not overloaded. But it's a real good way to have the additional connect with your client. And it also solidifies the fact that then they know that you have multiple products in your portfolio, not just the Medicare bag of tricks, right? So totally take a look at that. If you have not taken or don't know where my classes are, if you go to MedicareAnswersNow.com, click on the tab that says training, you will find a training calendar that has everything in the industry on there that I know of. And then there's a few drop downs, and one of them will be for sales training, and that's where you'll find it. And there's I think 3 or 4 core classes that I teach monthly. And then there's a whole bunch of other stuff that we do and we offer as well. So with that, I believe that we are at time. So Courtney, thank you so much for the time. We appreciate it. If you need the contract, like Courtney said, reach out to us or reach out to your FMO so that you can get up and rolling with them. And make sure that you visit Courtney and the Wellabe table at ms.med when you're there in a couple of months. So have
Yes,
a good one,
thank
guys,
you.
and I will talk with all of you soon. Thank you.